I said, you looked familiar. So I figured you had precepted before with us. And thank
Yes,
you for precepting.
yeah, yeah, it's always awesome to be there. So I usually go maybe once a month, not a lot. So
Even that is a very big contribution.
I think I get more out of it.
You looked familiar. Sorry, I just started the live, so the
Oh,
volume went through. Hello, everyone. Thank you for joining us today in our virtual health fair. We'll begin today with a short introduction on Shifa Community Clinic, and then we will allow our speaker to bring us wonderful information.
Hello, and welcome to Shifa Community Clinic's Outreach Virtual Health Fair. Today's topics include information about different birth control methods, healthy habits to control diabetes, to reduce cancer, and more, and how to maintain a healthy lifestyle. For those of you who do not know, Shifa Community Clinic is one of UC Davis's 7 student-run clinics that provides health services to the underserved and uninsured population of the Sacramento area. Our first speaker for our virtual health fair is Dr. Selma Shabir. She'll be giving a presentation about different birth control methods.
okay, so let's start and just making sure. Okay, awesome. I'm going to. I have also my slides up on my screen as well with my notes, so apologies for weird, strange delays. But let's start. So this is one of my favorite topics to discuss with patients, which is why I chose it. I feel that birth control methods, there's so many out there, and it can get really overwhelming for both clinicians and for patients to find the method that they feel works the best for them. So hopefully today's talk will help all of us understand all the different methods that are out there and which ones that each of us may feel may work better for our given situations and life circumstances. So we'll move on to the next slide. So if there's one thing that I want everybody to take away from this talk is this resource. It's called bedsider.org, and it is a wonderful, wonderful resource, online website with tons and tons of information about birth control that is coming out from clinicians who work and research in this field. And so if you ever have any question, any concern related to birth control, this is the website to go to. So if you get anything out of the talk, again, it's this slide. So let's go to the next one. And this graphic is taken from bedsider.org. I really like it. It has a ton of information, and the majority of my talk is going to be going into depth about this particular slide, actually. So this is showing you all the different types of birth control methods that are commonly used, and they're broken up into how well these methods work. So the top row, the orange box there, are going to be your methods that work really, really well. These are the methods that you can generally place and forget about them. And that's why they work really well. They don't take a lot of effort or work on the part of the user. And you can see on the right where it says, what is your chance of getting pregnant? It's less than 1 in 100 women for these types of methods. So if 100 women are using these types of methods, less than one will get pregnant. So that tells you that it's highly, highly unlikely to get pregnant while using these methods. And generally, these are the IUDs, the implants, and then sterilization. And I will get into details about all of these methods. The middle or green row, you can see that these work a little bit less well. They still work pretty well, right? So you have, if 100 women are using these methods, approximately 6 to 9 of them will get pregnant while using it. So that's still a low number. That's still, you have an efficacy or effectiveness that's in the 90% range. But these methods require more effort on the part of the user. A pill, you have to remember to take it every day. A patch, you have to remember to change it every week. A ring every month. A shot, you have to go to your doctor every 3 months. So these require more effort on the part of the user, and so hence there's more opportunity to forget or for it to fail somehow or whatnot. And then the bottom row in blue are going to be things like withdrawal, so where a man will pull out before ejaculating during intercourse, fertility awareness, which requires a lot of knowledge, intimate knowledge of how your body works, and knowing when a woman is going to ovulate, when they will be most fertile, essentially, or having the ability to get pregnant, as well as condom use, which is totally dependent on the user. So those are going to have higher chances of getting pregnant while using them. So again, it's a nice, neat little chart that's also available on the website. And I've broken up my talk into these 3 groups, essentially. So we'll go to the next slide. So on this slide, I just wanted to put up briefly a schematic or a graphic of the organs or the parts of the body that we focus on a bit when we're talking about birth control methods. So you can see in the top left, you have a female who's standing there. There's a box in black that's outlining the pelvic region. And in the pelvic region is where the uterus sits. So this is the uterus, right? The uterus is on the right side, shown kind of an enlarged view of that black box. And you can see where it says uterus. The uterus is where a woman, her period comes from the uterus, where babies will grow inside of the uterus, and where some birth control methods will sit inside of the uterus to help prevent pregnancy. You can see at the bottom of the uterus is the cervix, which is the opening to the uterus, and then from there you have the vagina or the vaginal canal that goes all the way down to the vaginal opening, which you can see at the bottom there is showing the vaginal area. That whole area where the vaginal opening is and the labia or the lips that are around the vagina, we refer to as the vulva. So I just wanted to kind of clarify some of those terms because they'll pop up in the talk. So we'll go to the next slide. Okay, so we're going to talk in a little bit more detail about that first row, that orange row. And we like to refer to these methods minus sterilization at the end. So really talking about the IUDs and the implants as long-acting reversible contraception. So these are probably the most commonly used methods in the world, especially the IUD. Not so much in the US, but the IUD is probably the most commonly used method in the world right now. They are long-acting because they can last for years and years, up to 12 years, actually for some of the methods, as short as 3 years or 4 years for the implant, and as long as 12 years for some types of IUDs. And they are reversible. So sterilization is not usually considered a reversible method, but the others are, and that means you can remove them and get pregnant again. And they're also the most reliable methods out of all the ones that we have. So we'll go to the next slide. So here you see an IUD, and I just wanted to show a close-up picture of the IUD so that people can see the shape and how small it is. So you can see it's in the palm of this person's hand, and there's some strings that are attached to it that are coming off the end. So let's go to the next slide. So on the right here you have a schematic again of how the IUD sits inside of the uterus. And I'll talk a little bit briefly about how we place an IUD so that people can understand. But one thing I want to point out is that the strings of the IUD sit inside the vaginal canal, right outside of the cervix. And that just serves as a way to know that the IUD is in the right place. And I'll get into that in just a minute. So briefly, let's talk about IUDs, or intrauterine devices. So intra meaning inside, uterine, the uterus, device. And there's 5 of them that are currently allowed to be prescribed or used in the US. 4 of them are hormonal and 1 is not hormonal. The one that's not hormonal is copper. And that was the picture that we saw earlier, those copper wires that were shown around the IUD. And it's a really nice method to have because sometimes people cannot tolerate hormones for some reason. So the copper IUD can be an option for people who can't do that. We mentioned that it can last for a long time. So let's talk a little bit about how these IUDs are placed. So this is not a surgery that a woman undergoes. It's a simple procedure that's done in the office. It takes a few minutes to actually do completely. Sometimes people are worried or concerned because they're worried about the pain that the procedure can cause. So for some women, yes, they can have some cramping and some pain when the IUD is placed, but that usually goes away after the procedure and within the next day or so. Some women sometimes will take like an ibuprofen before they have the procedure done. And we will generally tell patients if it's possible to have it done during the middle of their period. That's usually when the cervix, that bottom of the uterus, is open the most, and that makes it easier to place the IUD inside of the uterus. The beautiful thing about IUD and what makes it really the most commonly used method in the world is that once it's in, you can forget about it. You don't have to do anything else. Every once in a while, you may want to check the strings. You don't have to. Your physician can always do that for you during any kind of physical exam. And it's very easy to check the strings. It's like inserting a tampon, but it's not something that you have to do. Okay, so we'll go on to the next slide. So this is a busy slide, and I won't go through every single thing. Please feel free to go back and maybe pause the recording to look at the details, but just some things that I want to point out about the IUDs in terms of the cons. And generally, the most common complaints that we receive about IUDs is that with the hormonal IUDs and specifically, is that in the first few months of use, women can sometimes experience spotting between periods. And this is like a panty liner type of spotting. And that, for most women, will go away after the first few months of use. So that's something that I always tell my patients about up front so that they're aware that if this happens, it's a normal side effect from the IUD and that generally it will go away. With the non-hormonal IUD, what we call the Paragard, or the one that has the copper around it, you can sometimes get heavier periods for the first few months, and that usually lightens up and goes back to what a woman would experience as her normal flow. And with IUDs as well, sometimes you can have some cramps and backaches, especially in the beginning. And generally for most women, that goes away as well. So I like to tell patients this up front so that they are aware of what they may experience with an IUD and to discuss with them if that's something that they are okay with experiencing during those first few months of use. And also reiterating that after that, generally for most women, they don't feel it, they barely know that it's there, and it's providing excellent protection against getting pregnant. And I think we have a Q&A session, so if, as you see anything up here that you have questions about, please let us know. So we'll go to the next slide. So here I have a picture of an implant. And you can see it's a very thin, flexible little white rod that the person is holding between their fingers there. So let's go to the next slide and we'll discuss implants. So implants are They have the shortest time span for use, generally 3 years, but they can last up to 4 years. And the implant is something that's placed, again, it's a simple procedure that's done in the office that takes a minute or so, especially for someone who's experienced. It won't take very long. It's placed in the upper inner arm. So you can see where in the top picture, they're holding the implant up against the arm. That's generally where it's placed. And then in the bottom picture, you can see someone who has the implant already placed in the arm, and they are stretching the skin pretty taut there so that you can see the outline of the implant. And generally, if this person were to release the skin, you would not be able to see the implant. You would be able to just feel it by placing your fingers and just around that general area. And that's a good thing. We want our patients to be able to feel the implant, to know that it's there. And they wouldn't be able to see it unless they stretch the skin out like that. So again, to place it, just to review briefly how we place the implant, you numb up the area, and the implant is just slipped right in under the skin, and it literally takes a minute. So it's also another method that you can place and forget about it as well, and it will provide excellent, excellent protection. I have a lot of younger patients who like this method quite a bit and have this done, and it works really well for them. In general, I'll talk a little bit about this more later, but just to talk about its placement as well. If it's placed during the beginning first 5 days of a period, then usually it will provide instant protection against pregnancy. But if it's placed after a period, then we generally recommend that women use a backup method like condoms if they're going to be sexually active for that first week after the implant is placed, and the same with IUDs as well. Okay, so next slide. So here, again, a very busy slide. Just one thing that I want to point out is, again, the most kind of common complaint that we see with implants, and that's spotting. This is much more so than with the IUD, and it can happen for a bit longer, from anywhere up to a year, where women will experience some spotting. Again, not heavy spotting, but like panty liner spotting between their periods, and they may sometimes have longer and heavier periods as well. So this is something that I discuss with patients before they have the implant placed, because it can be a reason why some women want it removed. And I just, I want to make sure that this is something that they are okay with having, if that's a side effect that they experience after the implant is placed. Okay, so we'll go to the next slide. So the next group of methods are what we call kind of hormonal methods. I mean, the IUDs and the implants are hormonal methods as well. This group is, except for the copper IUD, of course, this group is entirely hormonal, and this is the group that requires more effort on the part of the user. So the pill, the patch, the ring, and the shot. And I put here a little note at the bottom about how these hormones work to prevent pregnancy. So these hormonal methods generally have two types of hormones in them, estrogen and progesterone, and they work by preventing the release of the eggs from the ovaries, which will cause ovulation, and then if there's sperm, the egg can become fertilized and can cause a pregnancy. They can also thicken the cervical mucus that will block sperm from getting to the egg. Okay, so let's dive into these. So pills, which is the next slide. So in terms of pills, this is the most commonly used method in the US right now. And there are generally two types of pills that we can break the pills up into. One is the combined pills, which have both estrogen and progesterone. And then there's one pill called the mini pill that's progesterone only. That's very rarely used. Usually for most women, they're going to be on a combined estrogen and progesterone pill. And that's because the mini pill requires a huge amount of effort on the part of the user. Mini pills, generally, you have to take them every single day pretty much at the same time every single day so that they can work effectively. And if you're not taking them at the same time every single day, they can have increased side effects such as spotting. They can also not work as effectively to protect pregnancy. So they're a little bit trickier to take. If anybody is on medications, it can be tricky to take the same pill at the same time every single day. So pills generally come in 21 pill or 28 pill packs, and that means that you take the pill that has the hormone in it for 21 or 28 days, and then the other, maybe the 7 days or the other few days in the 28-day pack are going to be hormone free or have less hormones in them, and that's usually when a woman will experience a withdrawal or a period type bleed. In terms of a period and how often a period can come with a pill, it can either be every month, so every pack, or every 3 months, or even once a year. So with the pills, the flexibility that it gives in terms of a woman being able to choose when she has a period can be a good thing. But again, here the main point is that it takes a lot of discipline to remember to take it at the same time every day. Okay, so let's move on to the next slide. One thing that I wanted to point out here is a lot of times women will go through many different types of pills because of the side effects that they will experience. So sometimes it'll cause like GI upset, nausea, maybe vomiting. Maybe it'll cause sore breasts, maybe it'll have bleeding in between periods or kind of funky periods. And for most women, I think the main point that I want to get across here is that generally these side effects go away after maybe the third pack of the pill, so 3 months in. Again, it's something that I discuss with patients beforehand. Is this something that you're okay experiencing and having to deal with potentially for 3 months? Because generally after the third pack, most of those side effects have gone for most women. If they continue, then we'll discuss changing the pill to something else. Okay, so let's go on to the next slide. So here's the patch, and the patch is the advantage of the patch is that it's less effort than the pill. The patch, you can see, is a thin beige piece of plastic, kind of like a Band-Aid essentially, that you place on the skin. And what happens is you'll place a new patch every week for 3 weeks, and then on the 4th week there's no patch that's placed. That's usually when a woman will start having a period sometime during that 4th week. At the end of the 4th week, you place a new patch on, even if your period hasn't stopped. So, and that's to continue to ensure the prevention of pregnancy, basically. And you can see here that the patch can be placed in lots of different areas. So one is on the back there, on the shoulder. You can place it on the tummy, on the buttock, on the arms. And it's nice to kind of rotate the position of the patch instead of using it on the same area, because it can sometimes cause a little bit of skin irritation if you're applying it to that same area every week. Okay, so we'll go on to the next slide. And just here, basically, in terms of the patch, very similar side effects like the pill. And also, it can take a few months for the body to adjust to using the patch, just like the pill. So if a woman is comfortable kind of writing out some of the side effects, generally they will go away after the 2nd or the 3rd usage of the patch. Okay, we'll go on to the next. So here's the ring, and you can see a picture of it at the top there. And at the bottom, it's showing a schematic of how the ring is placed. So I like to tell patients that the ring is like a tampon. When you place a tampon, the ring is very, very similar to insertion, basically. There are basically 2 kinds of rings. So there's one that we refer to as kind of the yearly ring, and this is a ring that you can use for a year. So what happens is you'll place it and you'll leave it for 3 weeks. And then during the 4th week, just like the patch, you'll remove the ring and you'll store it. And during that 4th week, that ring-free week, is when a withdrawal bleed will happen. And at the end of the 4th week, even if the period hasn't stopped, you'll place the same ring back inside the vaginal canal. And you'll keep doing this for 13 cycles with the same ring, and then you get a new one. So the nice thing about this one is you don't have to go and get a new ring every month. The other type of ring is a monthly ring, the Nuva ring, and that's where you use it just for one cycle and then you have to throw it out and get a new ring, basically. So, and just like the pill and the patch, you can use the ring to skip periods. And what we do to skip periods is we just have the user um, continue to take either hormonal pills or to use the patch or the ring during that 4th week. Instead of being ring-free or patch-free, they use the same method during that 4th week. They take it out at the end of the 4th week and they start a new one. So they'll start a new pill pack, or they'll start a new ring, or for the yearly ring, they'll just leave it in. And that's how you can skip periods, essentially. The nice thing about the ring is that it has a little bit lower dosage of hormones than the pill or the patch. So sometimes that may translate for some women into less of the side effects, basically. Okay, so let's move on. Again, just to highlight that the cons or the side effects associated with the ring are very similar to the patch and the pill. And again, it may take some time for the body to adjust to it, and to just having those conversations with our patients, or having all of you be aware of this and that it can go away after a few months of use. Okay, so let's move on to the last method in what we call the hormonal methods, and that is called the shot, or the Depo-Provera shot, or the Depo shot. So this tends to be the one where if a woman has experienced this, they either really love it or they really hate it. And it's, I don't know why, but it's this particular method has either really strong followers or patients who just completely hate it. And it is what it is. It's a shot that you get in the upper arm, just like any other injection, and you get it every 3 months at your doctor's office. The nice thing, kind of like the long-acting reversible contraceptive methods, is that you can have it placed and then you're done. You don't need to worry about it until 3 months later when you have to go back in and get it. So, so this is the kind of the good thing about the shot. One thing to note about the shot too is that if you're late more than 2 weeks in getting the shot, so if you've been getting it every 3 months and then you get to an appointment where you miss it and you don't remember for 2 weeks, then it's a good idea to get a pregnancy test and then get the shot. If you do get the shot, or if you take any of these hormonal methods and you are pregnant, it will not hurt the pregnancy. So that's one thing also to be aware of. So I've had patients who have gotten or started hormonal methods while pregnant. They were unaware that they were pregnant, and they do not hurt the pregnancy. Okay, let's talk about the pros and cons of the shot. So I'm going to touch upon the cons. Again, you have that irregular bleeding. So you can see that irregular bleeding pops up quite a bit whenever we try to change the hormonal system that's in a woman. It can cause some bleeding. It's a very normal side effect, and I always tell my patients that it's not something to worry about in terms of it doing some kind of harm to the body. It won't do harm, it's just more of a nuisance for some women. So the shot can cause irregular bleeding or spotting, especially during the first 6 to 12 months of use, and it can cause sometimes heavier periods in some women as well. So again, something to be aware of. For most women though, after the 3rd shot, they don't have periods, or they have very light periods. And you actually see that as a theme with some of these methods, the hormonal IUDs, the implant, and the shot. After maybe the 3rd cycle of use, like within 3 to 6 months, a lot of women will experience very light periods or no periods at all. And for some women, that's a huge benefit to not have a painful period every month, or to have very light bleeding or spotting instead of a heavy period. So that is a normal side effect, and generally in the medical community, it's seen as a benefit and not a harm to the user. The other thing with the shot to be aware of is that for some women, it can affect their appetite a bit and cause weight gain. And we usually see around a 5-pound weight gain in that first year. The women that I have had who have used the shot have generally lost the weight when they stopped the shot, who had that kind of an effect on. Okay, so let's go to the next slide. Okay, very briefly, I'm going to just discuss non-hormonal methods. These are the ones that all of us are quite aware of. So withdrawal, fertility awareness, and condoms, basically. So I'll move on to the next. So withdrawal, so otherwise known as like the pull-out method. This one can be particularly tricky to do, and it really requires a lot of understanding about the person's sexual response and their sexual patterns to be able to withdraw before they ejaculate. And also when the withdrawal needs to be a complete withdrawal. So there cannot be ejaculation onto the vulva, onto the outside of the vaginal region, because semen can move, and they can move into and up the vaginal canal. So that's the tricky thing with withdrawal, or with this particular method. But it can work, and if it's done perfectly every single time, then the woman will be protected from pregnancy. So it is an effective method if it's done perfectly. And then the second one, the fertility awareness method, I put it in here because it will remind me that for women, it's important to understand your menstrual cycle and your body. And the nice thing about the fertility awareness method is that it makes the person who's using it understand their menstrual cycle really, really well. So this method is where a woman will track her menstrual cycle to determine when are the days that she can get pregnant. And the tricky part is knowing when those days are. There's lots of different methods that a woman can use. And again, I would recommend checking out bedsider.org to understand some of those methods. Some of them are checking your temperature every single day, checking cervical mucus, so actually taking a sample from the vaginal canal of the secretions that are there and looking to see how sticky they are or how much you're having. And it just requires a lot of paying attention really closely to your body. The nice thing with this method, again, is like I said, there are lots of cool apps and ways to monitor secretions, monitor temperature, etc., as well as your periods. And I always recommend to all of my female patients to download what we call period tracker apps. There's Clue, Period Tracker, Eve, there's a bunch of them out there. And it's a great way to understand your cycle and your body. So let's go on to the next slide, because I think I have pictures. Yeah, so I just have some pictures here of period tracker apps. There's so many out there, and a lot of them are free. And I think I use the bottom, the Clue. That's the one that I use. So this really helps you to understand your period, to know what's normal, what's not normal. Periods can vary, even in one person they can vary. They can vary how often, how frequently they come. They can vary in their length. And so generally we say a period that happens between every 24 and 38 days is considered normal. And if it's equal to or less than 8 days in length is considered normal. Again, though, I would, if you have any concerns about your period, always talk with your provider, your clinician. But I just wanted to put this in as a plug for all of the female attendees to download and to monitor their periods. Okay, so we'll go to the next slide. So the next few slides are just to kind of summarize and reiterate some of the points that I maybe didn't get to hit in the previous slides. So when it comes to hormonal methods, and this is where counseling can be really important with patients, is understanding who can and cannot use a hormonal method. So there are two main types of hormones that are used in birth control. There's estrogen and progesterone. The pill, the patch, the ring, those contain predominantly estrogen and progesterone, whereas the IUD, the implant, and the depot shot contain only progesterone. And so if you think about which group is going to be more accessible to a wider range of people, it's going to be the one that contains only progesterone. Because with estrogen, there are some what we call contraindications, or there's some groups of people that can't use estrogen. And I've listed some of them here. So anyone who smokes, who's over the age of 35, anyone who has high blood pressure, hypertension, heart disease, migraines with aura. So migraines, headaches that happen with aura. Auras are where as the migraine is happening, the person may experience like floaters, or they may see lights or flashing lights or things like that. If the migraine headache doesn't have these things, then sometimes they can use the estrogen containing hormonal methods. And actually women who experience migraines just on their periods, so their periods are a trigger for their hormones, hormonal methods and birth control may help prevent those migraines. So they can help in some instances. And again, that's a conversation that a patient needs to have with their clinician to tease out when actually these methods may be helpful and not harmful. We know that estrogen carries sometimes a bit of an increased risk of blood clots or stroke. So somebody who has a family history of blood clots or who's at increased risk of a stroke, we wouldn't put them on an estrogen-containing method. Heart disease, liver disease, like hepatitis C, and then breast or liver cancer are also reasons that we would not use an estrogen-containing method. And then we would avoid progesterone, so the IUD implant and the shot. We would avoid those in people who also have breast cancer or liver disease. And sorry, I don't know if the allergies, yes, I put here allergies to copper. That shouldn't be in the progesterone category. That should just be for the IUD that has copper. So if you have an allergy to copper, you wouldn't be able to use the Paragard or the non-hormonal IUD. But anybody who has breast cancer, liver disease, if they have abnormal bleeding from the uterus, that would need to be figured out as well before they use any kind of birth control method, such as an IUD or hormonal method. And then pregnancy, obviously, as well. We would not use a birth control method in that instance. Okay, so we'll go to the next slide. So let's talk about pregnancy protection. So generally, if you start a method within the first 5 days of your period, then you are protected from pregnancy. So if you think about a period, right, the first day of our period is day 1. We ovulate around 2 weeks after that first day. So if you start a method within the first 5 days, then your body has time to build up whatever it needs to protect you when ovulation hits, which is when a woman can get pregnant. So you've given it enough time for that protection to start. If you start a method after the first 5 days, you haven't given the body enough time to kind of build up that protection. And so we always recommend that a woman uses a backup method with her partner. So condoms generally are the backup method for 1 week after they start the method. You can start a method anytime during your menstrual cycle, any day of the month, any day of the year. You can start any method. It does not need to be started during your period because we will have times where we can't make it to the doctor's office during those first 5 days of the period. It's a very slim window. But just something to be aware of. If you're planning to start a method, it's nice to start it during those first 5 days. And then the other question that we get a lot is about fertility. So will this method affect my fertility? Will it make me infertile or unable to become pregnant? In general, as clinicians, we always assume that a patient, once they stop a method, can get pregnant immediately. And I have seen that happen many, many times where a patient believes that they cannot get pregnant for some time after stopping a method, and then they rely on that protection and they end up getting pregnant. For most methods, fertility returns within the first few weeks of stopping it, except for two. So the shot and the implant are the two where you can see a delay in return to fertility. And especially the depot shot, especially if the patient has been using it for quite some time. So you can see a delay of up to 9 months, and I have seen that. But it does not make a person infertile. It just takes time for for the body to reestablish its normal hormonal cycle, that will eventually result in ovulation and pregnancy. So something to just be aware of when you're discussing or thinking about these methods. Okay, so we'll go on to the next slide. Okay, so I've mentioned backup method a few times, and just wanted to reiterate that backup method is, again, condoms. And there's two types of condoms. A lot of people are just aware of what we call male condom, and that's the condom that's placed over the penis. But there's also internal or female condom, and that's a condom that's placed into the vaginal canal and has a closed end at one end, which is the end that's up against the cervix or along the uterus, and then an open end, which sticks out outside of the vaginal canal. So there are two types of condoms. And some other times when a woman may want to use a backup method is not just when they start, but if they're taking certain medications. Some medications can interfere with the hormonal birth control, especially the pill and the patch and the ring. And so if you're ever on a medication, or you're starting a new medication, or you've gotten a medication, say for yeast infection or for UTI, it's always a good idea to ask, is it possible that this drug can decrease the efficacy, the effectiveness of the birth control method? And for the most part, it probably won't, but it's always a good thing to ask. And if it does, then what we generally recommend or counsel patients on is that they continue to take the birth control method that they've chosen. So the pill, the patch, the ring, whatever it is, and they use a backup method, condoms, during the time that they're on this medication and for a week after they stop the medication that is going to cause some kind of interaction with the birth control pill. Other times when you may need to use a backup method are going to be if you forget to take a pill, if the ring falls out, if you forget to put on the patch. So these kinds of instances happen, right? And so generally what we'll say is take the pill when you remember, put the patch on when you remember, put the ring back in when you remember, or if it falls out and you didn't notice, put it back in when you do notice, and then use a backup method for 7 days after. So, and one thing with the ring is if the yearly ring falls out for more than 2 hours, then its efficacy goes down. If the monthly ring falls out and stays out for longer than 48 hours, its efficacy also can go down. So usually you're not going to know how long your ring fell out for. So the general rule of thumb is to just use that backup method for the 7 days. Okay, so we'll go to the next slide. So we already talked about this, so we'll go on to the next one. Oh, and then the last point that I wanted to make is about sexually transmitted infections. None of these methods will protect you from sexually transmitted infections except for condoms. So the male condom or the female condom. But you need a physical barrier to prevent STIs. And none of these methods provide a physical barrier except for condoms. So that's just the last point that I wanted to make and to get across today. So the last slide is again just that bedsider.org, which is the website that I had mentioned in the very beginning that has tons and tons of useful information for all of us, and to check it out if you're really interested in this topic or have questions as well. And I'm happy to take any questions if any have come in. So.
All right, thank you for the very informative presentation and for being here today to help spread awareness. So I'll be just reading off some questions.
Okay, sounds good.
Okay. Our first question is, as most hormonal treatments have multiple side effects due to the way it affects hormonal balance, do you have any suggestions for how to get through the side effects most comfortably?
Yeah, it really depends on the side effect and having a discussion with the clinician. So if it's cramping or some mild pain, sometimes just Tylenol, Motrin, Aleve, Advil, any of those things may help with the pain. If it's the bleeding or heavy periods or spotting, those are a little bit trickier. It's going to be difficult to actually stop the spotting or stop the bleeding. It's more just monitoring for how much bleeding, and if it's really, really heavy bleeding, that's going to cause symptoms like dizziness, lightheadedness, feeling, faint or whatnot. That's a severe reaction. Then that obviously requires the patient to go in and get checked out. But just for simple spotting, like a panty liner spotting, it's more just what kind of behavioral modifications can you have. Like you keep a panty liner in your purse or your pocket or something when you go out, things like that. In terms of like nausea or upset stomach, sometimes taking it with food can help instead of just taking it on an empty stomach. So it depends on the side effect, and there are some things that can help, and sometimes there aren't anything that we have that can stop it. But generally, what I like to tell patients again is that if it's a side effect that's more like a little bit of a nuisance, but this method is one that really works for you and your lifestyle, asking them would they be okay having this side effect, and knowing that generally for the most part it'll end within the first cycle or two of using this new method, and kind of keeping that at the forefront. So
Okay, and then you mentioned that the pill is currently the most used contraception in the US. Do you happen to know why this might be when there are other options with less patient autonomy and risk of missing?
that's a great, great question. And that really gets into the history of medicine in this country. I don't know. I suspect that there are business and political reasons behind that. There is a great, great book that talks about this, and I'm trying to remember the name of it. I'll see if I can find it right now. But it talks about the history of the pill, and it's a really fascinating history. I am not 100% sure why the pill here has so much acceptance and use, given that we have methods that are so much more effective than it. I don't know, but that would be a great thing to research, and I'll try to look that up after, just for my own knowledge. And if I find any particular resources, I can share it with the Shifa team. We can post it maybe on the YouTube recording or whatnot. So yeah.
Okay, and then why should a smoker avoid taking birth control pills or the patch?
Yeah, so it's really essentially goes back to the risk of blood clots with estrogen. So if you smoke and you're over 35, the research has shown that that risk increases with estrogen containing birth control pills. And so that's why we generally don't recommend estrogen containing options to that category of people. Um, and in the hopes of also maybe helping decrease the smoking as well.
Okay, and then how does the copper IUD prevent pregnancy being a non-hormonal contraceptive?
Yes, so the really lovely thing about IUDs is that they really work locally inside of the uterus. So the copper IUD basically essentially acts as it causes kind of like a local inflammatory response within the uterus that prevents the implantation or the pregnancy from happening. And so that's essentially how it works. The thing that I didn't mention with the copper IUD, I don't think I mentioned it, is that it can cause the heavier bleeding, sometimes heavier periods in the beginning, versus the hormonal IUDs can cause more of the spotting type side effect. The difference also in the two over time is that the copper IUD you will continue to have periods with it. And again, if you remember, I said that they can cause heavy periods in the beginning. Eventually, a woman's periods will go back to what they were before. Whereas the hormonal IUDs, generally most women will experience lighter and lighter periods, and some women won't have any periods on them. But just to go back to the question about how they work, the copper essentially acts as like causing an inflammatory response within the uterus that prevents pregnancy from occurring. So
Okay, and then our next question is, why is the implant placed in the upper arm and not somewhere else?
yeah, that's a great question, and I'm not 100% sure. So basically, my guess is that it's an easy area to reach. It's usually hidden, right? I mean, when we are standing, walking around, working, our inner arm is tucked into the side of our body there, so it's not visible, but it's an area that we can easily reach. So like, why is it not placed in the thigh, for example? I don't know. I'm not sure why it was developed that way. I don't think it has to do with how the IUD works per se, but we tend to do a lot of injections and shots, especially in adults, right, versus kids who get shots in their thighs. We tend to do it in the arm for some reason, and maybe it's just an access issue. But it's a great question, and I'll see if I can find out some information about why it was developed to be placed there. So I'm not 100% sure why, but that would be my guess.
Awesome.
Yeah.
Our next question is, you had mentioned that the implant is partially hormonal. What is the other component that aids in birth control?
Oh, that maybe I misspoke or wasn't very clear. The implant is a hormonal method, so it's entirely a hormonal method. It's progesterone, which is the same hormone that's in some of the IUDs, the mini pill, the depot shot. And the nice thing about the implant is that the dosage of progesterone is very, very low, but it's continuously being released all the time for the 3-4 years that it's in place. So it's an entirely hormonal method.
Okay, and then does the type of birth control pill with varying levels of estrogen/progesterone levels determine how often you will have your period?
Yes, so let me backtrack a little bit to answer that question. So pills, they also come in not just do they contain estrogen and progesterone or just progesterone, where the vast majority contain both estrogen and progesterone. But the ones that have estrogen and progesterone, they can vary in the dose of estrogen and progesterone in one pack. So they can either be the same dosage of estrogen and progesterone, and those are called monophasic. There can be biphasic and triphasic pills, and that's where the dosages of these hormones vary from week to week in the pack itself. So the question was, can the triphasic, I think, or the biphasic pills affect the bleeding, right?
Yes.
Yeah. Yeah, yes. So you can see sometimes more irregular bleeding with some of the triphasics with the packs that have differences in hormone concentrations. Again, generally for most women, it takes a few packs before their body adjusts to this new hormone, um, in terms of the amounts of hormones that their body is seeing. And for most women, generally that spotting or bleeding will stop. If it doesn't, then it's a bothersome symptom to the patient, then generally it's worth having a discussion with the provider about changing to a different type of pack. And seeing what works best. But yes, they can sometimes cause more of that irregular spotting and bleeding to happen.
All right, and then though birth control pills can sometimes be prescribed for irregular periods, are there other reasons why patients would be prescribed the pills besides the original intent?
Yes, there's lots of medical conditions actually where we'll prescribe pills or hormonal methods, not really for pregnancy protection, but for the medical condition or the symptoms that the patient is experiencing. So one of them I mentioned was migraines that can be triggered by your period. We have a lot of women who experience that, and pills actually really help decrease the migraines that happen. Other things that we may use these hormonal methods for besides pregnancy protection is if a woman has really painful periods or really heavy periods. a lot of these methods will either take away the period, lighten it up considerably, and really help with those symptoms. So we'll have a lot of teenagers, for example, as they start their period, they're experiencing lots of pain. They're missing days of school. We'll have women who miss days of work. They're really unable to function during, especially the days before, leading up to, and the beginning days of the period, right? When we experience these menstrual cramps strongly. For some women, those cramps just wipe them out, and they may have nausea, vomiting, whatever it is. And so these methods can really help control those kinds of symptoms. PMS, if that's another phrase that people have heard, premenstrual syndrome, kind of goes along with that. So these methods can help quite a bit with those things, and yeah.
All right, and then our next question is, why is it better to move the patch around to different spots on the body every time it is changed?
Yeah, so the main reason is just to prevent the irritation of the skin. So if you think about just a Band-Aid that's been wrapped around your finger for a few days, the skin around it can get kind of like macerated, or can get irritated and red. It hasn't had really much contact with the air, especially if you've been washing your hands a lot or whatnot. So the nice thing about rotating the patch around is it just decreases the chances of skin irritation. And for some women, maybe they don't need to move it around. Their skin doesn't really react to the adhesive that's in the patch, and they're fine using it in the same place. So it's really just to prevent that.
Okay, it looks like those are all the questions we had for today. If you have any more questions, feel free to email us. Thank you again to our guest speaker, Dr. Shabik, for taking the time to be here and to talk to us today. As we wait for our next speaker's presentation, we will present some more information about our clinic and its resources.
Okay, hello everyone. I will be showing you how to find the different resources that Shifa Clinic offers. If you search up our website, shifaclinic.org, it will take you to our homepage, and this is our homepage. At the top, you can click the tab that says webinars, and this will take you to a page where it shows you all of the previous webinars that we have done. You can see them listed here, and then also the corresponding webinar infographics for each webinar. Additionally, if you click on the Health Services tab and then click Health Education, you will see that there are a lot more resources available for your use. And a lot of them have been translated into different languages, specifically Spanish, and then I think some of them are also in Urdu and Arabic. They include exercise videos and a cookbook with healthy recipes. There are cookbooks specific for diabetes and hypertension. And then lastly, if you click on the Health Brochures tab under Health Services, there are other topics that you can look over that maybe if you want to read about them in a different language, including Arabic, Hindi, Urdu, or Punjabi, you can do so here. So if we go back to the home page, as some of you may know or may not know, Shifa has its own COVID-19 vaccination clinic right now and is offering both Moderna and Pfizer. Moderna is for those who are 18 and up, and Pfizer is for those who are 12 and up. We are open every Saturday and Sunday of the week, and we are open for vaccine appointments and walk-ins. On our website here, shifaclinic.org, there will be information about what vaccine is being offered at what specific weekends. So you can see here for this weekend specifically, the appointments that were made, and for the walk-ins that are available for 9 a.m. to 1 p.m., it's for Moderna. And so that way you can see if maybe you fall under the category of people who are allowed to get Moderna, and you can come in and get your vaccine from Shifa Clinic. So if you have any questions about that, you can call us at the number listed here, 916-573-6941, or you can send us an email at vaccine.shifaclinic at gmail, vaccine.shifaclinic@gmail.com. Those are only actually some of the resources that we offer on our website. We have a lot more under health services. And then if you go under the webinars, our speakers have also offered a lot of other resources for you just within their presentations. So go ahead and take full advantage of Shifa's website because it is a wonderful resource for our community. Now we're going to get back to the virtual health fair. Our next guest will be presenting at 11 or maybe sooner about healthy habits to control diabetes or reduce cancer. And then the last speaker will be presenting at 12 p.m. about how to maintain healthy lifestyles. So thank you, everyone, and we will see you again for the next speaker.
Hi, Dr. Prescott. How are you doing?
Hi, I'm doing okay.
More than 10 for international for ML. ALT. Joining us today.
Yeah. So how do you see this working?
Yes, so the way that this will work is we'll allow you to share your screen, or if you prefer, we'll share our screen and flip through the slides for you. And it will begin with Madeline giving a short introduction, or I'm sorry, Natalie giving a short introduction, and then you can present, and afterwards we'll do a Q&A. And then as soon as you're done with your section, you may like or stay for our third presenter.
Okay. All right. All right. And then I'm in a room with somebody else right now. Can you hear that other person?
Yes, we can hear the other person.
Okay. So then I'll try to move.
And just to let you know, we're currently live streaming the meeting. So we have it all set up on YouTube for you, and we will read the questions for you.
Okay.
You don't have to worry about finding them.
Okay. Okay. And so I'll let you then do the slides. All right.
Yeah, that's most definitely okay.
Okay, cool.
Do you have any updates to your slides, or is what you
No.
sent us?
No,
Okay.
they're the same.
And then what tickets would you like to start in the HIV post-infected patient?
And so what time do you think we'll start?
We'll start in the next couple minutes.
Okay, all right. So I'm just going to blank out just a minute so I can see where else I can go.
That
Okay.
is totally fine. Thank you so much for joining us.
As
well as for hepatitis B. If the patient says not treatment for HIV, just treatment for hepatitis B, then don't give tenofovir. Give tenofovir, it's like treating HIV with a single drug. So give them pegalopentoprol is what we're using for treating hepatitis B only. They don't want to be treated for HIV. So if you want to be treated for both HIV and hepatitis B, then use tenofovir as well as part of the regimen for HIV. They'll take care of both HIV as well as for hepatitis B. The patient with hepatitis B on alpha-intermol should be monitored for what? For hypo or hyperthyroidism. That means you'll be checking PSH. If prior to starting bevacizumab or chemotherapy with steroids or TNF-alpha agents, what do you check? You check core IgG antibodies and self-antigen. If any one of them is positive, you do it for up to 1 year with tenofovir after stopping the rituximab. If it was a infliximab, you continue up to 6 months after stopping the infliximab. Rituximab up to 1 year. Asian American young woman with hepatitis B in the third trimester, how do you prevent hepatitis B in the child? How do you prevent hepatitis B in the child? That is, you want to give tenofovir for the mother, hepatitis B vaccine, and immune globulin in the newborn. That's what we're going to be doing. Yes, it's all. Hepatitis C, single-stranded RNA virus. Most common cause of liver transplantation in the United States, yes. Most common presentation is fatigue and elevated liver enzymes, yes. Risk groups would be IVU, drug users, prisoners. They'll do more testing in prison. And blood transfusion prior to 1992. Yeah, that's when we discovered hepatitis C. We discovered in 1992, but it's existing for, I don't know, for how long. So tattooing and snorting cocaine can also cause hepatitis C. Yeah, tattooing I can see with contaminated needles. Snorting cocaine, apparently people snort cocaine, contaminated cocaine, that someone snorts who has hepatitis C and they snort the cocaine and they have nasal preparation and they have a drop of blood falling on the cocaine and they share the cocaine with somebody else. And that contaminated cocaine, when they snort, they can also get hepatitis C as well. Men who have sex with men, again, can have hepatitis C. There's no vaccine yet, there's no immunoglobulin, but
Hi, can you see me okay?
Hi, the camera is just a little high. Oh, that's perfect.
Okay, good.
Okay, are you feeling ready to begin?
And then, is there a way I could see the slides? You're going to introduce me, then you're moving the slides over, correct? So that I can actually see them?
We're actually sharing them right now.
And it's just that they're very little.
Oh, are they?
Yeah.
What you could do is,
Because I see the slides, but they're like this big.
do you have us on the right of the slides?
Yes.
If you go just slightly to the right of where the slides are, there's this gray bar that will light up.
Yes.
You can pull that over to the right by holding on your mouse.
Okay.
Make them bigger for you.
It didn't do anything.
Didn't make them big enough.
Uh-uh.
In the top right, you can see a button that says View. If you click that and then click Standard.
There, I can see them. Can you see me?
Yes, we can see you. And
Okay,
if
cool.
you would like to move the rest of us out of the way so you can see all of your slides, you can click that little minimizing button on the top left where we are sitting. It should be right above your image.
Oh, okay. So I see you very clearly. Now you're small. Before you were large. Now you're small.
Okay.
And I'll just move you over. Okay. Oh, let me go grab my water. Sorry.
Okay, take your time.
Okay. Am I sitting okay?
Hi, Dr. Prescott. I'll be sharing the slides for you today. So if you need to go to the next slide, you can just say, and we're moving on to the next slide, and I can change that for you.
Okay. All right. And then just for the first slide, if we could just wait a moment, because I'm asking them a question. And then the third slide, if we could just wait a moment to allow them to think, and then we'll move on.
Okay, perfect. And I can read to you the responses that they have, or Madeline can even read it.
Okay. And then, okay.
Okay. And just to introduce ourselves to you, my name is Diana Suki, and I'm the outgoing outreach coordinator for Shifa.
Cool.
My name is Madeline, and I'm the incoming outreach coordinator.
Cool.
And my name is Natalie. I am a member of the outreach committee.
Okay. Thank you for helping me.
She is also one of our translators at Shifa, so we really appreciate her volunteering with us.
Cool. Thank you very much for organizing this and helping me.
Oh, of course. We're actually very thankful for you joining us and being willing to do this with us today. Okay, if you're feeling ready, then we can go ahead and begin, and Natalie can start when she's ready as well.
Hello, everyone. Welcome back to our virtual health fair, our second speaker for the event is Dr. Prescott. She will be giving a presentation about healthy habits to reduce cancer, to control diabetes, and more.
Whenever you're ready, Dr. Prescott.
Oh, thank you.
Of course.
Thanks. Hi, good morning. Thank you very much for joining all of us to talk about important health aspects and how to improve overall health. Today, I want to concentrate on improving our health and our knowledge about diabetes. But to begin with, let's look at this first slide. And I want you to consider how many practices in your life do you know to be healthy? I want you to think about it a minute. If you would like to mention out loud, that would be very good, because we'll then, those that do respond, we will let everybody else know what the response was. So how many practices do you know that are healthy?
So we have one comment saying healthy exercise and healthy eating are practices that they know that
Cool.
are healthy.
Yeah, very good. Those are really good choices, actually. And those are always important to keep in mind. Next slide. As you were thinking about ways to improve your health, could you quickly come up with a lot of different reasons? This health article listed 99 ways to improve our health. I couldn't really think about 99 ways, but if I mentioned out certain things, you know, I could come up with individual things: brush your teeth, floss, use seat belts when you drive. Next slide. But how many of those things that you know to be healthy do you practice every day? Think about them just for a moment. So, do you exercise every day? If you know that that's to be healthy for you, what do you do each day to be healthy?
So we have some comments. We have, I believe 3 of my practices are healthy: maintaining a healthy workout, drinking water, and sleeping. And then we also have another comment saying that they're unsure.
Yes, and so many of us are unsure, because the fact that I like green tea in the morning, is that a healthy habit? I know brushing my teeth and flossing is a very good healthy habit. But what about taking vitamin C? You know, I've got allergies right now, so does taking vitamin C help me? So there are many things that we sort of have flittering through our mind that we think might be healthy for us, but we don't necessarily commit ourselves to it because we're not absolutely sure. Like vitamin C, does it really help allergies? Next slide. So the WHO decided that all of us should have certain healthy habits that could make us happy and decrease the risk for many diseases. And you're not going to be surprised by what you see on these suggestions. And as somebody already mentioned, eating a healthy diet is right there at the top of the list. Second is the exercise issue, that all of us need to be physically active, and it needs to be every day. But they also specified that it's your way. You do exercise that meets your needs and what you feel will get you healthy. And getting vaccinated, we all understand that now with the COVID and trying to make a decision about whether we're going to be vaccinated. And I've been vaccinated against COVID. And so I'm really happy that I had the opportunity. And then there's not going to be any surprise at all when it's mentioned that we shouldn't smoke or use any form of tobacco, including the pouching in the mouth. And then alcohol it is a personal issue, but we have to minimize it if possible because it is actually healthier for many reasons. And then number 6 is really important, and it has become more and more important as we go forward. And one of them is relieving stress and getting enough sleep. And one responder also mentioned the stress, the sleep and how important it is for them. 7 is good hygiene. This is brushing our teeth, flossing, those things. And then 8, don't drink and drive. That makes sense. And then wear a seatbelt and practice safe sex, which is a very reasonable suggestion. And then they advocate regular checkups for our health. And then breastfeeding is best for babies. So the WHO has given us sort of a broad scope. What I want to mention are what happens if we want to have healthy habits that are directed at helping us prevent things. So today I would like to mention which of the habits are best for preventing cancer, which of the habits are best for preventing a heart attack, or which of the habits are best in controlling the glucose and decreasing the complications of diabetes. So if we take a look at what the next slide, please, at what the Cancer Society says about reducing the risk for cancer, you're going to notice that there are many things that are replicated that were mentioned by the WHO. Eat right, lose weight, get moving with exercise. And then of course, don't smoke or stop smoking. But they also mention that reducing the blood sugar is helpful for reducing cancer. And that's important. And I'll answer questions about that a little bit later. And then obviously, managing blood pressure and cholesterol are also important for reducing cancer risk. And then if we have to consider, well, gee, this sounds similar to what the WHO said, and it sounds awfully a lot like what would happen if we wanted to reduce a heart attack. And so if we go to the next one, we see, yep, it's stated again. It's important for us to move around. And what's interesting about how each of the societies place their recommendations for healthy practices for the target of trying to reduce heart disease, look what the number 1 suggestion was. It was getting active. Isn't that interesting? That if you want to prevent a heart attack, the most important thing you could do is start out with a daily activity, at least 30 minutes. Stop smoking, that's really important. Maintaining a healthy weight, knowing your numbers, and by that they mean you recognize your own hypertension risks by knowing your blood pressure and knowing what your cholesterol is, and then eating healthy. And it's sort of interesting when you think about it that exercise is more important than eating healthy, although they're both very important. It's important to look at what will stimulate heart improvement. It's definitely exercise, and then a diet in low saturated fats. And then, of course, knowing the warning signs for a heart attack, knowing how men and women might different. Men might have chest pain, but women may not necessarily have chest pain if they're having an acute event of their heart. They may have something else like nausea or feeling tired or having shortness of breath. And then their last suggestion, which is important for everyone, is taking medications. That once the medications have been prescribed, each of us need to do as much as possible to take our medications. Now let's take a look at diabetes. And we're going to notice that it's very similar. The WHO recommendations, the Cancer Society recommendations, the American Heart Association recommendations, they're all very similar. And as you can see, to control diabetes, it's eating healthy, taking medications, being active, and as in decreasing your risk for a heart attack, it was important to know what your blood pressure is and cholesterol. In diabetes, it's very important to know what the blood glucose level is. And then also, diabetes can be a very stressful condition. And one of the ways to help lower the glucose level and actually decrease weight is to have good emotional well-being. And then lowering the risk of diabetes complications comes from blood glucose monitoring and taking medications. The next slide, please. So these, out of all of what the WHO says, what Cancer Society, the Heart Association, the American Diabetes Association, these are the healthy habits that are suggested by these organizations. And then it's weight loss, exercise, eating well and healthy, learning to relieve stress, taking your medications, and quit smoking. I'm going to stop here just before we go forward for us to talk about diabetes more specifically. I want to stop a minute to see if anybody has any questions.
So we have one question. How do you recommend relieving stress? Are there any recommendations that you have for doing this?
Yes. One is, the first is to recognize which part of our lives are the most stressful. Is it work? Is it taking care of our family? Is it a medical illness? Trying to figure out which are the largest stressors. The next then is choosing a way to accept the stress, but then relieving it by using your body's natural tendencies to try to decompress and relieve stress. So it comes in many forms. Some individuals do meditation and breathing. Some individuals exercise. Some individuals talk to friends or family. Some individuals talk about how to release stress with a counselor or a psychiatrist. Other individuals don't try to flee from the stress, but try to interact to see if there's some way that it can be turned around. Say it's a work issue, that some way that you can see what the issue is, work with those individuals, or recognize what part of the job is the hardest, and see if there's some way through the job you can relieve part of the stress. And then it's the next thing is reevaluating, deciding whether you're feeling better, sleeping better. If your goal is to lose weight, losing weight, then you can tell whether what you've chosen to do can help relieve the stress.
Thank you. And we have one more question. How can emotional well-being affect risk of diabetes?
Oh, that's a very good question. It's just important to understand that as it is to try to get rid of the stress. What happens when we're stressed is we tend to not follow through with some of the things we know that are important for us to do. Like, our mind becomes a little blocked, and we say when we're stressed, we deserve to eat certain foods because we're so stressed, and this is something positive for us to be able to eat those Cheetos or the chips or the cookies, because in effect we deserve them, and it's a payback for living through the stress. And so we don't think as clearly, and we don't try to stay to the healthy habits when we're really, really stressed. The next thing is that the stress hormones, when we're very stressed, these hormones can raise our blood sugar. They can raise our blood pressure. They can change how our heart responds to stress. And it also changes a little bit how we breathe. So stress can cause problems in our heart. It can raise our blood pressure. It can change, the hormones can change and directly raise our blood sugars. So there were a couple of studies done, and the Heart Association in about 2015 put out guidelines about how to change the blood pressure or lower the blood pressure without medications. The two ways that they chose to do it without medications, one was exercise, and the other was transcendental meditation. By learning a process of clearing your mind, breathing, turn things around, it lowered the blood pressure, it lowered the glucose, and allowed individuals to stay on track for what they were trying to achieve with healthy habits. And so that's why a lot of health organizations have relieving stress up there on their suggestions for healthy habits, just as they do for taking your medications. You would think that the Heart Association first thing out would be take your medications, but no, it's exercise, it is healthy diet, and then relieving stress before taking your medications. So let's talk just a little bit about diabetes itself. And if I could see the next slide. So these habits, many of you I think, probably understand why being so active makes a big difference for diabetes. But I'll talk about each one separately. And then in the end, I will talk a little bit about the medications that lower the glucose. But we should start with the healthy habits first. If I could see the next slide, please. So losing weight. Everybody will know and are shaking their heads, I'm sure. Yes, I know we're all supposed to lose weight. But if you lose only 5 to 10% of your body weight, this automatically decreases your cancer risk, heart attack risk, diabetes risk, and risk of developing hypertension. So you don't have to go all the way back to your lowest weight ever. It's just shifting the weight down a little bit. There's a lot less stress on the body. Next slide, please. And how are you going to do that? Well, I bet you could tell me how we're supposed to achieve losing weight and eating healthy. And some of the best suggestions from most of the weight loss programs are, one is eat lower calorie diet, meaning that if you're maintaining your weight and you don't want that weight to be where it is, you have to lower the calories in your diet. And so what do you lower them with? You lower them with clean, healthy food, most of which you prepare over food that is either bought in a fast food restaurant, or quick foods. Those foods that you prepare at home will allow you to eat a lower calorie diet. And then eating a consistent diet from day to day, meaning that if you have a well-balanced diet one day, where you have mostly vegetables, some carbohydrates, which you see here is rice, and then protein with chicken, or tofu if you're a vegetarian, that you eat similar foods the next day. Why? Because the anticipation and your willingness to accept the diet and keep going on the diet is easier than if you're trying to change the diet a lot. And then you might begin to get worried if you're having to change the diet every single day. And the most important suggestion that most of the weight loss programs say is that we all ought to eat breakfast. And the bulk of our calories ought to be with breakfast and lunch, with the minimal calories with our evening meal. And then exercise, of course, making our muscles better at being able to take the food we're eating and transfer out fat. And they were suggesting also that you check your body weight frequently. This is not every, 5 times a day frequently. That's not what's being suggested, but it was at least once a week. And then if you notice that either you're not losing weight or you've gained weight back, that you start corrective action and you make a decision. Is it the type of foods I'm eating? Is it the style? Meaning I'm skipping breakfast again and I'm eating most of my heavy meals at night. Then you begin to change it back. And if you do, you'll be much more successful. And I'm going to stop a minute here to take any questions.
So we have a question. What is the best or most healthy way to lose weight if you're already diagnosed with type 2 diabetes?
same precepts, exactly the same precepts. You take a look at your diet. If your weight is higher and your glucose levels are higher, then you take a look at your diet and rearrange the components of your diet. So for all of us, it should be a higher amount of fiber from vegetables, a quarter of what we eat for a meal should be a good complex carbohydrate, and then a quarter to a third would be our protein source. And so if it's unbalanced, if you find that it is, you're not getting enough fiber from your vegetables, then you would rearrange your diet so that you would that would help you. And certainly at Shifa Clinic, it would be important to meet with the health advisors. And if you could meet with a dietitian, that would be really helpful to get this kick started again for you. Now, some people have asked me a lot in the past about certain particular diets, like fasting, like the keto diet, or the low glycemic index diet for diabetes. And I can say yes, 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 they are all helpful depending on what you want to do. They each will help you lose weight, lower your glucose level. But here's the problem, particularly with the keto diet. And depending on which keto diet you choose, it becomes difficult to continue that diet over time. So if you're just eating chicken and butter or steak and butter and are not eating vegetables, you will lose weight, but you will never be able to continue on the diet or keep to it, so that you'll rebound and maybe gain higher. A low glycemic index diet can work. And what that means is every food we eat goes to sugar, everything, even a lettuce leaf. But it goes at different rates. So a lettuce leaf doesn't go to sugar in our blood as fast as rice does. Rice is, an easy way in for sugar. And so it's trying to limit certain foods, not getting rid of them completely, but limit certain foods that go to sugar fast. And then eating foods that don't go to sugar so fast. So if you look at this picture, broccoli and string beans are a good source of fiber. They do have carbohydrates, but the carbohydrates get into the blood really, really slowly. Whereas the rice gets to the bloodstream, it's almost, you smell it and the glucose starts going up. Are there any? And then fasting. Fasting can work. The problem is that if you're going to fast, you have to make sure that you are working with somebody who can remind you to do certain things. Fasting, you have to drink your fluids. You have to have electrolytes. You cannot use it as the only means of losing weight. So I've had some people say, oh, I fasted for a week. No, it can't be the only way. You'll never lose weight doing that type of fasting, mostly because people overeat. So what fasting, how it's usually done to be successful is 1 or 2 days fast.
Okay, and we have a follow-up question. So you would recommend that the best way to do this is through these precepts instead of doing like the main diet culture crash diets?
Yeah, that's why it's important to talk with one of the health educators, there are a lot of diets that that you have that would work perfectly for losing weight. But it could be that it's been skewed a little bit. Those foods that you really like, that your family really likes, have been skewed where certain parts of it have more importance than other parts, and thus it causes an imbalance and only raises your glucose and makes it hard to lose weight. And so one way to help you is to meet with one of the health educators or meet with a dietitian so that you can choose the foods you like, that your family likes, but figure out how you can adjust them. Like for me, I grew up with rice. I really like rice, but I simply don't eat it anymore. Now, that may not be the solution for you. So what I do though is, I use all of the funny substitutes, cauliflower rice, zucchini, noodles, to trick myself into thinking that it would be okay. And so for rice, is there any type of rice? What about brown rice? No, the difference between white and brown rice, they both go to sugar fast. Well, then what about, when we get to talk about medications, I'll mention what kind of medications you can take to allow you to be able to eat some rice. So you do not have to throw out all of the foods that you're used to. You just need to learn how to rearrange the foods so that it allows you to keep your glucose levels down and to lose weight.
And another question is, are there any types of exercise that would be the most beneficial to losing weight?
Yes, if we go the next slide. So all of us, every last one of us, have to do 4 types of exercise. We're all familiar with aerobic exercise, and that's walking, riding our bike, swimming, playing badminton, tennis. All of these are aerobic exercises, and that's the mainstay, being able to keep our glucose levels down and to lose weight. And I'll come back to this in a minute. We then have to, particularly in diabetes, we have to build up our muscles. In diabetes, the glucose levels go up because they have no pathway out of the bloodstream, and there's just too much coming in and there's no way to get it out. So one way is to build muscles. If you build muscles, then the glucose has some place to go, because muscles need a lot of glucose to do their jobs. And for men, once you start doing weight training for your arms and chest, since you have a bigger muscle mass, your strength training will have a big impact on lowering glucose levels. For we women, of course, we can build muscles, but we tend not to go exactly to the extent that we should to actually build stronger muscles in our upper body. We don't mind them so much in our legs, but we sort of hang back. So strengthening needs to be the upper body for all of us and our lower body. Balance helps us because as we get older, it keeps us from getting frail. If we're not careful about understanding or knowing what happens to our body as we're moving, we're going to fall and crack our heads or break a hip. So it's important for all of us to do strength, aerobic, and balance training. Now, the stretching is to help relieve the muscle stress of what was just done. And it is also a stress reliever to be able to stretch. How often do we have to exercise? You're not going to like this one. Our glucose levels can be an issue every day. We have to exercise every day. Now, it doesn't have to be the same thing every day, but we need to be doing something every single day. Now, I got the question. I'm sorry, I apologize. I heard the question about which exercise to lose weight. You can be healthy and not lose 1 pound with exercise, but you're reorganizing your body to be stronger, lowering your glucose levels, decreasing your heart attack and cancer risk by simply doing the exercise, even though you don't lose weight. So if you don't exercise and start at all, and you start exercise program, you will begin to lower your pounds. But if you are already an exerciser, then you may be disappointed with how much your exercise helps you lose weight. Now, I'm using it just as an example. I'm not suggesting that you do this much, but that program, The Biggest Loser, I don't even know if it's on anymore, but that program, The Biggest Loser, when people would go from 500 to 200 pounds. And they wrote an article about how much of everything everybody had to do and eat in order to lose their goal. To lose weight, the participants had to exercise 2 hours every day. So it's not, exercise is amazing for weight loss, but you've got to exercise. But you can still get very super benefits to your overall health to decrease risks if you figure out a way to exercise every day, but it may not help you lose weight. So does that mean, oh, no. You remember for heart disease, exercise was on the top and then weight loss was a little further down. So exercise in and of itself has many positive things. And so we should do it because it's healthy. And then if we want to lose weight, then we have to up the amount a little bit more than what we're used to.
And we have one more question about fasting.
Mm-hmm.
Instead of long fasting, how does intermittent fasting in a 16-hour fast, 8-hour eating fit your fasting instructions?
It can work. There are plenty of studies on that style of fasting, and it can work. It's just, you just have to be careful. That's all. It works very well. The fasting for most studies has to be later, meaning that you are eating earlier in the day and then doing your fast later and through the evening, not flipping that around. And that you keep to your plan of eating, because sometimes when I've had several patients tell me, well, fasting was so good for me. And I really think that I'm going to lose a lot of weight. But sometimes I get so hungry, I just eat everything in the cupboard. So it's keeping to the style of how you're going to eat, how you're going to accomplish it. And then it can work. You just have to be careful about that stimulation that your brain is going to go, oop, where is this food? And then it's going to make you want to eat.
And it looks like those are all the questions we have right now.
And then if we could go on to the next. And emotional wellness. It was really hard to stay optimistic this last year with everything that we had to go through. But it's important to understand that this emotional wellness, that enjoying what we're doing, enjoying our family, enjoying our job, enjoying living, is very important to our overall well-being, and particularly in making sure that the glucose levels don't spike up and stay up high. All right, next slide, please. So another way to stay healthy is to know what your glucose level is. Because if you know, then you know whether you have to adjust or not. And you then know whether what's working and what's not. And most of the time, I get comments like, oh, I just want my medications to take care of my high glucose levels. Yes, I mean, we'll talk about the medications in just a moment, but you want also your staying optimistic, doing your exercises, changing your diet if you need to. You want that to be the front runner for lowering your glucose levels. And the only way you're going to know is by doing glucose checks. So currently available to everybody at pretty low cost are doing finger sticks, where you actually get blood and have it read on a machine. But there are now alternatives. And the next slide, please. The alternatives are continuous glucose sensors. And these devices check your glucose every minute of every day. 24 hours a day, these are checking your glucose level. And you don't poke your finger anymore, but you let this device, which is placed, some of the devices are placed on your arm for 10 days, and then you change it out. And other devices stay on your arm and read your glucose for 14 days. And the beauty of these are that you know instantaneously, did my broccoli make my glucose level go up? No. Did my eating rice, did that make my glucose level go up? Uh-oh, by golly, it did. So you can tell really quickly the consequences of many of the things that you are doing day by day by day, hour by hour. Oh, I didn't sleep very well last night. Oh, good golly, my glucose level is much higher this morning than it usually is, probably because I didn't sleep well. Next slide, please. How these sensors work. When we do blood glucose monitoring in our fingers, we are getting blood oozing from blood vessels. When these glucose sensors are placed on our arms, it goes into the interstitial fluid. And in the interstitial fluid, the blood glucose swims around this sensor that stays there. And over time, the interstitial fluid gives us a really good representation of what the glucose level is. And we can generally use it for immediate. There are some times when we can't exactly tell. Next slide, please. Now, I only meant I don't expect that you can read this, and I apologize for the big, all the information on this slide, but I wanted to be able to tell you that there are many medications to lower your glucose levels. And all of the medications that are available do lower it, otherwise they wouldn't be available. And they each work differently. Next slide, please. So we have to have a way to tell when all of these medications are going to be helpful at lowering the glucose levels. And at all times, diet and exercise are a part of the treatment plan. You've had diabetes, you were just diagnosed. Diet and exercise are important. Oh, you've had diabetes for 20 years. Diet and exercise are important. So always they're in the background. But if we're going to talk about the medications alone, then I've given you some examples. I didn't put every single medication on the list here because otherwise it would turn out and look like that chart that I just showed you previously. And so I tried to take a representation of the medications that are available to have you have time for us to talk about the medications. And how I've chosen to tell you about the medications are how high your glucose levels are. So, and we do that by what your hemoglobin A1C is. Normal hemoglobin A1C is 5.6 or lower. So if you had a hemoglobin A1C of 6%, oh, I'm sorry, I should have put here, I apologize. The outright diabetes is diagnosed with a hemoglobin A1C of 6.5%. So if your hemoglobin A1C is 6%, that's not 6.5. So you have pre-diabetes, not outright diabetes. You still need a medication. Diet and exercise can work, and if you can get your hemoglobin A1C back to 5.6%, no medications are needed. But if it's going to stay at 6%, then the medication that we should be using is metformin. Now, you'll notice that metformin is used all the way across. If your hemoglobin A1C is 10.5%, the base of your treatment is metformin. So why would that be? Well, one, metformin has proven to lower glucose levels. But it also has something else that's really important. It prolongs life. Individuals who are on metformin live longer than individuals with diabetes that aren't on metformin. So metformin lowers glucose, but it preserves good cardiac function. Now, if your hemoglobin A1C goes up higher, say 7.5%, now you're truly in the diabetes range, then we want the hemoglobin A1C to be 7% or lower. So if you're on metformin, you will stay on metformin. And then we have a choice of other medications in order to bring your glucose back down to 7%. Diet and exercise are in there, but we can add to the metformin one of these other medications that you see. We can add Januvia or glipizide or Actose to the metformin to help lower the glucose levels. Now, we're going to go, which of these are the better choice to add to the metformin? Well, a couple of things. One is we don't want to gain weight. We don't want to gain weight. We do want to protect our heart and kidneys. Do any of those other drugs help us with that? Yes, Januvia. And I'm using Januvia as an example for all the other drugs that are cousins to Januvia. Yes, Januvia can be heart protective and kidney protective. Can glipizide be heart protective? No. Glipizide's job is to lower glucose, but it does not help metformin to protect your heart or kidneys. And it's harder to lose weight on glipizide. So why in the heck would we ever give glipizide? It's because it's cheap. It's very inexpensive, and it is available to all. Now, Actose. Actose is a medication that makes insulin work better, and it can be heart protective. So Actose and metformin can protect the heart. Actose's one little problem, though, is that a lot of people gain weight with it. So if you're not careful with your diet, the weight comes on. Now, what happens if the glucose levels are higher? So usually if it's 7.5%, we have 2 drugs. For 8.5%, usually we have 2 or more drugs to lower the glucose. So we could use glipizide, but as the hemoglobin A1C is going up, glipizide is less and less effective, as is Actose. So we have to think about medications that are a little bit more powerful when the hemoglobin A1C is so high. One of the medications is Trulicity. And Trulicity and Januvia sort of work about the same way, but Trulicity is much better at its job. Januvia is a pill, Trulicity is an injection. And Trulicity protects the kidneys, protects the heart, helps you lose weight, and it is a great in combination with metformin. In fact, once Trulicity is started and somebody is on glipizide, sometimes we can get rid of the glipizide and the weight comes streaming off. Now, what happens if the hemoglobin A1C is higher? It is 10.5 or 12. Then we have to go do something that is higher strength in order to get that glucose level down. Diet and exercise could definitely, particularly a diet change, could get you down from 10 to 7. But we would keep metformin and Trulicity. But in order to get it going the other way, usually we have to start insulin. Now, everybody groans with the thought of insulin. And it is true that there are problems with the insulin, but when the glucose level is as high with the hemoglobin A1C of 10.5%, sometimes these other medications can't work. Because it's a problem of how well the insulin, our own insulin, is being made and how well it works. So we have to add a little bit to get the glucose levels down. And if the glucose levels can come down, then we can get rid of the insulin. It doesn't have to stay. But when the glucose levels are this high, sometimes the pills quit to work, and sometimes even Trulicity, the injection, stops working. Now, there's one drug I didn't mention, and that's this. It's called Jardiance. Jardiance is a very particular medication, and it makes us urinate glucose. When we urinate glucose, it helps us lose weight. And this drug also protects our kidney and our heart. This is somewhat better at protecting the heart than the kidney, but it helps both. This one is somewhat better at protecting the kidney than the heart, but it does help both. This drug, we have to be careful with all of the drugs, but this drug, we have to be a little bit careful about watching what the glucose levels are doing, how is the diet working, to make sure that peeing off all that sugar and peeing off all that water does not shift our electrolytes or shift and give us other conditions. So I'm going to stop here just for the moment and take some questions.
So we have a question. What is the relationship between the amount of sleep you get and a person's glucose levels?
It has to do certain things, like if you have very disrupted sleep, you snore, you stop breathing during the night, that gives you an extra couple of hemoglobin A1C points. So you could go from 6 to 8 or 9 very easily if you have disordered sleep because of obstructive sleep apnea. Obstructive sleep apnea also increases your risk for heart attacks and then kidney damage. So we need to sleep, and we sleep for a reason, and all of us have to sleep. And so if it's very disruptive, then there are consequences to it. So if somebody wakes up every morning with really high glucose levels, I ask them about their sleep. Are you snoring? How many times do you wake up at night? Does your spouse say that you stop breathing during the night? And has your spouse moved out of the room because you snore so loudly? Then we have to figure out a way to deal with the obstructive sleep apnea. The other is having too short a sleep, so that if your work is very busy or there are family obligations and you're only getting 4 to 6 hours sleep, that isn't enough, because our body rests and reactivates itself by our sleep. Also, if you go to bed and you sleep 12 to 16 hours, you are at a disadvantage that if you sleep 8 hours a day. So the sleep specialists tell us we have to go to bed at the same time every single night, that we have to wake up even on the weekends at the same time, so that our sleep pattern is set for us, and we need 8 hours of sleep.
And we have a follow-up. Can you just explain what HbA1c means?
Oh, hemoglobin A1C is the diabetes test. And we have to find a way to be able to know what the glucose level is doing over time. So when you do a glucose check, we know immediately at that moment in time what your glucose level is. But we don't know what it was, 2 weeks ago, yesterday. So we need a test that averages the glucose level over time, and that is the hemoglobin A1C. And the hemoglobin A1C is that on our hemoglobin, on our red cells, get coated with sugar. And that sugar is measured. So if there is a lot of sugar, then our hemoglobin A1C goes up high. If there's less sugar, then it is much lower. And so the average, it gives us the average for about 3 months. And it's the single most important test to tell us where we are as far as our glucose levels are.
And another question is, with these medication regimens, they are quite extensive. What are the side effects of those that miss a certain aspect, say for reasons of forgetfulness or availability?
Forgetfulness, that's why everybody stresses, the Heart Association and the Diabetes Association stress the importance of the medications. And so it's a really important question that was asked, that these drugs were designed to work for a certain length of time and need to be given in repetition. So like metformin, for some individuals, it has to be twice a day for work. Other medications like Januvia only have to be given once a day, and Trulicity is once a week. So the drug, the pattern is defined by the drug itself, how it was made and how it was tested to be able to tell us the best way that that drug can lower the glucose levels. So the studies determined that metformin is best when it's given twice a day. Januvia is just fine once a day. Insulin can be given once a day, or it can be given 4 or 5 times a day. And then the side effects. Every drug on the planet has a side effect. And then when you use them in combination, sometimes you're accentuating or making worse the side effects. Like if metformin by itself does not usually give hypoglycemia. But when you add metformin to any of these drugs, then the risk becomes of hypoglycemia, and that's a low glucose level. The other is the intrinsic drug itself. What kind of side effects? Now, for metformin, the biggest side effect is lactic acidosis. Now, let me explain that one just a little. Metformin cannot harm the kidneys. There's nothing in it that harms the kidneys. But if the kidneys or liver are harmed by something else, and they are not working, then metformin will cause more acidosis in the blood. But of all of the drugs on this list, metformin has the least side effects. Trulicity, which is an injection that you give once a week, has side effects. One of the side effects is that it causes people's appetite to go down. And when the appetite goes down, you lose weight. So it was never the original intention for the Trulicity to help with weight loss, but there's no question that it does. The drug like Jardiance makes you pee sugar. It has a box load of side effects, and some that can be very dangerous, and including infections and fasciitis and kidney failure. So we have to be just a little careful. Insulin, of all of the medications, is the easiest to move around. You can have it, you don't need it anymore, then you immediately stop it. But it has side effects, of course. The two biggest ones are hypoglycemia and weight gain. What other questions are there?
So it looks like those are all the questions we have for today. I just want to thank you so much for being here and participating in our virtual health fair to help us spread awareness to our community. So thank you so much.
Good. It was good talking with you.
You too.
Bye.
And now for our next speakers, I just want to introduce Dr. Ada Ezenekwi and Dr. Caroline Peck, and they will be giving a presentation about how to maintain healthy lifestyles through proper eating, sleeping, and more.
Hi, can you guys see my screen? Okay, great. So hi, my name is Dr. Ada Zanekwi. I'm a preventive medicine resident with the California Department of Public Health. And I will be and my talk will focus mainly on wellness and self-care activities. Let's see. So this is just an introductory slide. So we're going to discuss the importance of wellness and self-care. We're going to talk about the different dimensions of wellness, and I'm going to provide some examples of self-care activities. So the importance of wellness and self-care. So what is wellness? Wellness is a term that's been very prominent lately in media, especially with regards to like work from home and occupational wellness, like wellness at work and things like that. But normally, wellness is usually thought about in terms of physical health, so like nutrition, exercise, and weight management. But actually, wellness encompasses much more than that. Wellness is really the integration of physical, mental, and spiritual well-being that encompasses your entire wellness. And why is wellness important? So wellness is important because one, it provides us with a more personalized approach to how we live our lives. Two, it reduces stress. Three, it reduces the risk of illness. And four, it improves our positive social interactions with ourselves and with others. So, okay. I wanted to ask a question to the audience. So how many, you might have already seen it, so you might have cheated a little bit, but how many areas or dimensions do you think there are to wellness? They can just type in the chat probably. I'll let you think about a number in your mind real quick, or you can type in the chat. The answer is, right now, there are actually 8 different dimensions to wellness, much more than I thought previously. And so there are actually 8 different areas of wellness, and all of them are important in order to improve your overall well-being. The different dimensions of wellness are listed here. So there's emotional wellness, spiritual wellness, intellectual wellness, physical wellness, environmental wellness, financial wellness, occupational wellness, that's like the wellness at work type of thing, and social wellness as well. So all of these different areas contribute to your overall wellness. And so the main thing with this is not to get overwhelmed with the large number of dimensions. The most important thing is to start with small steps and work towards building good habits, right? So you can say, you know what? I'm gonna work on improving my emotional wellness, okay, and take time for me and be able to decompress and things like that. And you can start with small steps in just one area and then build habits in that area. You can try to tackle a couple of areas. And we're gonna discuss some good habits that you can build that kind of address a number of areas, right? So important things like sleep and things like that, which we'll discuss, can hit multiple areas, right? So we're going to give you, some activities you can do to tackle to tackle multiple areas. And good habits can improve, like I just mentioned, good habits can improve several wellness at the same time. But the important thing is to start with small steps and build towards good habit. Don't try to take on a lot at one time. You can get overwhelmed that way and end up like not wanting to do it, or end up not meeting the goals that you set for yourself and things like that. Okay. And so the first the first area we'll talk about is sleep. And the most important thing here is adequate and restful sleep. Dr. Prescott discussed sleep in her presentation very well. Sleep is very, very important. Too much sleep is not great. Too little sleep is not great. That 7 to 8 hours is kind of the sweet spot that we're trying to hit here. And so sleep allows your mind. So why is sleep important? Sleep allows your mind to process what happens during the day. Sleep is important in getting well. Like sleep is important if you're sick. Sleep helps in the healing process and things like that. So some habits you can build with regards to sleep are: 1, getting up or going to bed and getting up at the same time every day. This sort of trains your body in order to sleep for a certain amount of time. Another habit is to stop eating and stop exercising, stop using electronic devices at least 2 hours before going to bed, to kind of give your mind and body time to decompress and kind of move into that sleep sort of state, if that makes sense. And another habit you can build is to have a sleep routine. So drinking tea, okay, chamomile tea is used for sleep. Hot milk, warm milk usually works for like children. It can work for adults too. Meditating, practicing gratitude, or even just kind of being in a cool, dark room, turning off your senses and sort of just kind of trying to fall asleep that way. These are all good habits that you can build towards improving your sleep. And we can all improve incrementally. It doesn't have to be all at once. Like if you sleep for 5 or 6 hours a day, you shouldn't try to rush to sleep for 8 or 9. Even if you get an extra 30 minutes or 1 hour even, that's an improvement, all right? And you can build on that as you go along. So the next habit we'll talk about is healthy eating, right? So eating whole, non-processed, unadulterated foods will improve digestion and increase energy. And the food you mainly want to focus on are fruit or vegetables, fruits, nuts, grains, legumes, fish, fermented foods like yogurt, with occasional meat and sweets if desired. We want to minimize processed foods and eliminate sugar-sweetened drinks such as soda and juice. Once again, this is all about starting small and building good habits, right? If your diet is and also drinking water is also very important here too. If your diet normally consists of eating processed foods for 3 meals a day, right? It's best to, like, for example, take 1 meal and incorporate vegetables for that 1 meal, right? And gradually build that way. Trying to kind of overhaul and change everything so drastically may work for some people, but it doesn't build the good habits. It doesn't build the habit, and incremental change helps people to stick with their diets better. By the time you know it, after a few months, like 2 out of your 3 meals now have vegetables and whole grains and things like that. So you can start small. You can say, okay, you know what? I'm not going to drink juice for 1 meal, or I'll add vegetables to the side for this meal, or for 1 meal, I'll have fruit instead of dessert. You see what I'm saying? So it's all about building good habits. Start small to build habits that will stick. Okay, next. Oh, wait. See, next slide. Okay, so daily movement. So moving your body is extremely important, right? Moving your body increases flexibility and fitness. It improves your sleep. It improves your mood, improves your appetite, and prevents disability. You can do it, like the awesome thing about movement is you can do it with a friend. You and your friend can walk together, exercise together. This also helps to decrease loneliness, which is a social aspect of well-being, of wellness, and increase your happiness, increase your mood, improve your mood. You can start off small. Once again, we don't need to jump into working out 3 hours a day at the gym every day. We don't need to do that immediately. Start off small, build good habits, start with small steps. 15, 20, 30 minutes a day. Walking outside has huge benefits. If you can't go outside, if you have stairs in your home, you can walk up and down the stairs, put on some music, walk up and down the stairs for 15, 20 minutes a day. You can take a walk. If you have a backyard, walk around your backyard. Like, there are ways to, it's all about just moving your body, getting that blood flow going, improving your overall cardiovascular health. And so start off small. And also make sure that whatever activity you choose to participate in, that you actually enjoy doing it, because if you enjoy doing it, you'll stick with it, right? You'll want to do it. You'll look forward to doing it. And then it won't seem like a chore at that point. You'll just enjoy doing it naturally. Okay, next one. So caring relationships. So this addresses emotional, social wellness. Like, it addresses many areas of wellness, just like the other habits that we discussed. So human beings are social beings, okay? We interact with people on a day-to-day basis. And so whether physically, like face-to-face, or even virtually, right, we're social beings. And studies have shown that we live longer, we're healthier and happier when we spend time with those that we love. Caring relationships are respectful and supportive. Those help to build us up. Those types of relationships help to improve our overall wellness. And you can have these relationships with your family, friends, colleagues, even your pets. Like, pets make people very happy. People have amazing relationships with their pets, with their dogs and their cats. Sometimes they even seem to care more about their dogs than their spouse. That's a different thing altogether. But yes, it's all about improving your overall emotional and social well-being. And so you can do this by spending time together in person, abiding by, your local pandemic rules, obviously, or via video or on the phone, or via email. When I was in college, I went to college in a different state from where I grew up, where my family was. But I maintained my relationship with my parents. They called me initially every day, but then once a week. And that still kept me in the loop of things. I still felt a part of, my family, even though I was far away physically. So any interaction in caring relationships is great. Let's see. Building resiliency. So life not just can be, life is stressful, okay? Especially the past year, everyone the world over, okay, has had a very stressful year. And so in order to sort of help decompress and build resiliency, it's good to practice stress protective activities, such as moving, like we talked about moving every day, moving around every day, meditating, practicing gratitude, just being thankful, okay, for being alive, thankful for your family, things like that. You can even keep a journal, okay, taking a walk, getting in tune with nature, just things that help to sort of relieve stress and decompress, and to relieve stress and decompress. Spending time with those you care about, okay, also helps towards this goal as well. And avoiding bad habits. These are all things that we can do to decompress and build up resilience in. Next is spirituality. So one of the dimensions of wellness was spirituality. And spirituality is the basis for our values and beliefs in ourselves and in the world. And it really influences how we interact and see the world. Spirituality doesn't necessarily have to derive from a particular religion, although religions do aid in that. You can not be religious at all and still have and maintain your own personal spirituality. And so spirituality gives purpose and meaning to what we do in life, as well as how and why we do it. And it's really important for maintaining health and overall well-being. So I put this here just to remind us and to know that spirituality is very, very important in wellness. Environmental wellness. And so where we live and where we work really impact our health. And so a lot of us may be working from home, cooped up in our apartment or in our house. Even if you do go into work every day, you also work in a building, probably, most likely. And so getting out of that cage, I don't say caged in, but in that restrictive environment and spending time in nature really helps to improve our overall well-being, sort of helps us to kind of recenter ourselves and helps to relieve stress as well. So going out to your local parks, okay, walking around through trees, walking alongside rivers, looking at mountains or climbing mountains, just getting involved, just getting to nature and your natural environment can really do things to help you improve your overall wellness. And it kind of, like I said, helps to recenter you and kind of helps your mind to kind of breathe a little bit. I know it does for me whenever I go out in nature. It just helps to kind of like, I don't know, just kind of help me to refocus, you know? So also though, tips, be aware and avoid exposure such as severe heat. So if it's 100 degrees outside, you don't really want to go out in nature. Or if it's very cold as well, you don't want to spend too much time outside. And avoid going out if there are wildfires, or if there's smoke, if there's a smoke hazard and things like that. You don't want to put yourself in danger just to go out, just to go look at nature, right? You have to be practical about these things. So those were sort of habits that we can build in order to address many different areas of wellness, many different dimensions of wellness at the same time. And so next I'm going to discuss self-care activities that we can do. And these activities will range in time frame. So there's activities that we can do every day. So day-to-day activities. And these are basic self-care practices that are simple, inexpensive, and usually done every day. So for example, brushing teeth, drinking water when you're thirsty, spending time with loved ones, getting adequate and restful sleep, participating in physical activity, and eating nutritious foods. So all those habits that we talked about, these are things that you can incorporate every day in a day-to-day basis and building those habits, taking those small steps every day. And that these are things that you can be in control, that you are in control of, that you can do, Next, we have activities you do from time to time. So visiting your doctor for regular care, or if you have a new health problem that pops up, visiting your dentist for regular care, or if you have a dental issue that pops up, and using non-prescription, over-the-counter medication or herbal products appropriately from time to time as needed. Next, we have more in-depth self-care activities. So we talked about spirituality as an important dimension of wellness. So prayer, if that is something that works for you, meditation, journaling, gratitude, we talked about, getting a massage, okay? That is a self-care activity. Aromatherapy, decluttering. Some people, by decluttering, it kind of helps to like make it like changes their whole personality overnight. And so that's also a self-care activity because it makes you more productive. It can make you more productive that way. And lastly, more collaborative self-care activities. So after meeting with your doctor or health educator, some self-care activities are: one, taking medication as prescribed by your doctor to help you get well. Following a healthy diet and exercise plan as recommended by your health educator. And also, like I said, with spirituality, meeting with a spiritual advisor, an imam, a priest, rabbi, pastor, whomever is, if you have an advisor, whoever your advisor is, can also help. Is also an important self-care activity just to kind of help with your spiritual wellness in that aspect. And so we went over a number of activities that you can do and incorporate even today. Small steps, right? The importance here is small steps to build good habits over time. We want these things to stick. We want to be able to reap the benefits days, weeks, months, years from now. And so even if you can just do one thing, taking that first step is really important and will benefit you in the long run. So thank you for listening to my presentation. If you have any questions, please feel free to ask. Either myself or Dr. Peck will respond. So thank you.
Thank you so much. We actually do have a few questions. The first question being, how do you recommend we maintain the creation of this balanced lifestyle to increase our well-being while working full-time or having an increase in stress?
Sorry, can you repeat it one more time? I cut off a little bit.
Oh, I'm so sorry.
No, it's okay.
The question is, how do you recommend we maintain the creation of this balanced lifestyle to increase our well-being while working full-time or if we have an increase in stress?
Yeah, I will say, balance is very important. It can be difficult, especially, like you mentioned, like the person who asked the question mentioned, with regards to having a family, working full time, being in school, it can be very difficult. But I think if you look at it sort of more longitudinally, right? So maybe on one day, you may not be able to get in the self-care activities or the wellness activities that you were hoping for, but maybe tomorrow, the next day, you can plan for it. So I think planning is also very important. If you're able to plan, even if it's like 15 minutes during your lunch break, okay, maybe right before your kids come back from, maybe before your kids are done with school or before dinner or things like that, and you can incorporate some of these small activities. Yeah, so it's all about finding. You don't need. It's hard for us to find these long stretches of dedicated time. So 15 minutes here, 15 minutes there, 15 minutes before you go to bed, like all of these, it's all about finding time when you can to kind of incorporate these activities. I don't know if Dr. Peck has anything else to add, but. Oh, I think she's muted. I think you're muted, Dr. Peck.
Thank you so much, Dr. Isenekwe, for this wonderful presentation as well as your response to this question. And I completely concur with what you said. We have given you everything that you can do, but like we understand that there's a lot on everyone's plate right now. And so choosing maybe just one good habit to start practicing regularly, just 15 minutes a day, as Dr. Isenekwe said, and commit to that one thing. And I think over time, you'll be able to add more, but it's really important for self-care to be good to yourself, to give yourself that time and say, I am worth 15 minutes to make myself feel more sane. But we understand it's hard. We understand the challenges that everyone is facing right now.
Thank you so much for that response. Another question that we received is, what are specific diseases or health concerns that these activities prevent?
Well, so as Dr. Prescott actually mentioned in her presentation, a lot of these activities help with improving diabetes and heart disease. hypertension and things like that. And so especially the physical wellness, so nutrition, weight management, and managing stress levels can aid in a number of diseases. But the big hitters, the diseases that hit most Americans, are heart disease and diabetes. And so these things can really help. If you don't have it, it can aid in prevention. If you do have these diseases, it can aid in maintenance and maybe even help in improvement. And so so those are at least two big diseases that just having wellness, just improving your wellness overall can help with or prevent.
Perfect, thank you. And another question we have is, why do you think it is so hard for people to begin the first step in doing these activities?
Oh, great question. I think that, there's a number of reasons. The first reason is that people in general, especially the older you get, either do not like or are afraid of change. I know with personal experience, change can be very daunting, okay? Especially if you're already used to something, you have a routine that you go through. Change can be disruptive and change can be scary. What if it doesn't work? Okay, what if I can't do it? Like just change in and of itself can be a huge barrier for people to make that first step. And so that's why I emphasized and stressed during my presentation that it doesn't have to be, because the larger the change, the more reluctant people are to do it. And so starting with small steps, okay, like I said, you don't have to change what you eat an entire day, okay, right now, but you can just throw in a banana, or like eat, instead of having dessert, have some fruit, okay, for one meal, okay? Throw in some vegetables on the side, just these simple things. So the smaller the change, the easier it is for people to handle, the easier it is for people to do. And so I think managing the first step, making it small and something you can actually do and act on, is the best way to get started.
Another question that we have is, will incorporating these aspects in our life aid in battling mental health illnesses?
Yes, definitely. Especially like emotional, social, spiritual wellness can really help with mental health issues for sure. Things like depression and things like that. And so that's why all of these, I put the dimensions of wellness here on the screen so that people can be looking at them. But all of these different facets, dimensions of wellness, will help with improving mental health. Like people, there are people who, when they exercise, like it helps them mentally, makes them happier, gives them endorphins and things like that. Interacting with people in positive, building relationships helps with mental health as well. So all of these different aspects of wellness definitely does help with mental health and improvement in mental health for sure, definitely.
Okay, we have one more question, and it is, what kind of self-care do you enjoy indulging in?
Oh, me? Oh, okay. Great question. So right now, especially with because of COVID, I really enjoy gardening. Gardening kind of helps hit a lot of different things for me. One, it helps with the physical wellness because I'm growing my own food, my own fruits and vegetables. Okay, I don't have a big garden. I have like my little, it's not that big. I don't have a big house. But I grow my own fruits and vegetables and herbs and things, and I can use that when I'm cooking. And that helps to avoid processed foods and things like that. And also just being, digging in the earth and being in that, digging in the earth and planting things, dealing with critters that come and try to eat my plants also helps with the environmental aspect of as well. And planting different things is very exciting to, grow your own food and eat your own food. And so I think that's something that I really do. That's one that I really do enjoy. And you can, if you want to start gardening, you don't have to have a big plot of land. You can start with herbs and put it in your windowsill. You can grow basil, you can grow cilantro, you can grow all types of herbs, and you can start there and then build from there as well. So gardening is something that I highly recommend.
Thank you. We have 2 more questions. The first being, which do you find are most harming when not taken care of? Specifically, which one of these aspects is the most important to keep an eye on to ensure we feel our best?
So which aspects of the wellness, dimensions of wellness? I see. Okay. Like I mentioned, we normally think of wellness as like eating right, exercising, and making sure we maintain a healthy weight. But the more I learned about wellness, the more I feel that all of these different dimensions are actually very important. And I don't think one is more important than the other, but if you had to choose one, probably physical, just because that really has like a severe direct effect on diseases and things like that. But I think they're all very important, especially now with people working from home. Occupational wellness is very big right now in media. Being able to take time during work to de-stress and to kind of gather your thoughts and things is very important. So I think they're all important. But if I had to choose one, I guess physical well-being, but they're all important though.
Thank you for that. And another question we got is, as students, we have very little time and very weird hours that we can do things. As such, what would you say to prioritize the most for mental health? Sleep, interaction, self-help, etc.
Very good question. And I definitely understand. I've been in school for a long time, so I totally understand that students have weird schedules. Students don't have that much time with your direction being pulled in so many different, your attention being pulled in so many different directions. I think that I think it's important to try to sort of build balance. So sleep is very important. I remember when I was in college, having to pull all-nighters, having to pull all-nighters to finish assignments, having to finish group projects, having to finish exams. And sure, I may have gotten it done, but it wasn't necessarily at my best. And I felt terrible, horrible the next day. And so being able to avoiding all-nighters is very important. It really drains you, and it really it really affects you mentally, pulling especially multiple all-nighters back to back like that. So getting adequate sleep, even if it's 6 hours, just start where you can with adequate sleep. And you can even take naps, like even between classes. Like I usually go back to my dorm and took a 1 hour nap, 30-minute nap when I can, in order to help supplement my sleep schedule. With interactions, it's very important to have positive interactions with your peers. And so because there are interactions in college that are not so positive, that can build bad habits. And so finding those key people, it could be a peer, a professor, whomever, that help to build you up, and that kind of help have a positive outcome on you is very important. So you don't have to go to every party. You don't have to, you don't have to be like socially everywhere, but just being able to fit in those 1 or 2 really positive, caring relationships, like interactions, is important. And they mentioned something else. What was the third thing they mentioned? It was interaction, sleep, and something else.
Self-help.
Self-help. Yeah. Self-help, like getting help when you need it. I cannot stress this enough for students, is super important. All right. I understand. It feels like it can be overwhelming at times as a student. So reaching out to a counselor, reaching out to a mental health professional when you need that help is actually very important. So you listed these three things. I can't pick one. They're all important, especially for students. I know these three areas were, like, when I was a student, like, were sort of ignored amongst a lot of us. And so I can't pick one. I would urge you instead to try to fit in all three of them if you can. Like I said, if you don't have enough time to sleep, take naps when you can. And you don't have to be around for everybody, but have one or two important interactions and things like that. So yeah, so that's my answer.
Thank you so much for that response. I think that is all the questions that we have for today. And so I'd like to thank you for donating your time to us today in order to bring this very valuable information. You and Dr. Peck, both of you, especially for this portion of our virtual health fair. I do want to remind everyone to please visit our website, shifaclinic.org, in order to register and make an appointment to receive the COVID-19 vaccine if you are interested, as well as to access all of our health resources that we have. And I'm going to provide the floor to Madeline to make any more closing remarks.
Thank you, Diana. So yes, I'd just like to thank our audience for joining us today in our virtual health fair. And then once again, thank our wonderful guest speakers for coming today and donating their time to speak with us. So yes, thank you so much. And I hope everyone has a wonderful weekend.
Thank you very much.